Hello, everyone. Good morning. Welcome to the 2021 CAPASUS webinar series. I am Catherine Chong, President of the Chinese American Academic and Professional Association in Southeastern United States. Our co-host, Ms. Esther Chiu, who is our digital media manager, will help me to go over the chat room and to manage your questions. It is our great pleasure to see you join us for our second webinar in 2021. The Chinese American Academic and Professional Association in Southeastern United States was established on June 25, 1977 in Atlanta, Georgia. We usually call it CAPASUS. As a nonprofit organization, the objectives of CAPASUS are first, to provide opportunities for all members to exchange their academic, cultural, social, professional, and business knowledge and experiences. And second, to make academic, cultural, social, professional, and business contributions to the communities in Taiwan, in the United States, and in many more areas. In the past, CAPASUS hosted a 2 to 3 day annual meeting and many other local events every year. Due to the pandemic, we look forward to providing events with useful advice for all community members. Therefore, we designed this webinar series. On February the 27th, Dr. Oliver Du has kindly given us a talk titled The Promotion and Preservation of Chinese Language Heritage, Experience from Homeschooling, Facebook to Chinese Debate International. Now we are moving on to another topic, which is to use the research method of data analytics to discover the criminal activities during the pandemic. This is a topic closely tied to our daily lives. Our speaker is Dr. Edward Huang. Dr. Huang is an associate professor in the Department of Systems Engineering and Operations Research at the George Mason University. He had received his BS and MS degrees from National Tsinghua University in Taiwan, then another MS and PhD degrees in Industrial and Systems Engineering from the Georgia Institute of Technology. Dr. Huang's research focuses on supply chain analysis. He has been primary investigator, PI, or co-primary investigator of several projects funded by the National Science Foundation, the Air Force Office of Scientific Research, the Intelligence Advanced Research Projects Activity, the College Industry Council on Material Handling Education, and many other federal agencies. Today, Dr. Huang will talk about the operations of illicit actors in the cyber world, the supply chains and payment systems for online drug sales, counterfeit pharmaceuticals, and personal protective equipment, or PPE, during the pandemic. There are a lot of newspaper articles, a lot of news on the internet talking about all these kind of counterfeit pharmaceuticals and PPEs. Increasing demand for personal protective equipment has created fertile ground for production and sale of counterfeit goods. On February 18th, the Department of Homeland Security just announced that they had identified more than 10 million counterfeit 3M N95 masks and started almost 900 investigation cases. These masks do not have the same protection effectiveness. These illicit supply chains of vital medical products pose unprecedented risk to public health and security. Dr. Huang will introduce the types of the criminal activities during the pandemic and discuss the possible research directions on disrupting these illicit supply chains. Now, let's welcome Dr. Huang.
Okay. Thank you very much, and thank you for the invitation to give a talk. And my name is Edward Huang, and today I will give the talk on let's say understanding, modeling, disrupting this drug and counterfeiting illicit supply chain. So in this talk, I will give you a brief introduction about myself, who am I, and what kind of research I have done in the past 10 to 20 years. And then we will go to today's topic, let's say type of crimes in the COVID-19 pandemic. And we will see like what's the major, let's say, activities, crime activity we have observed during this pandemic. Then today, I think I will focus on the two major topics. First one is a counterfeiting mask. So let's say the surgical mask and the respirator. So we will see like how do we produce this kind of a mask? Why do we see so many, let's say, the counterfeiting mask on the market? Where do they come from and how do they produce it? So we will have that. And then the last small topic, we will say like as a user, let's say as a customer, if you buy any mask, how do you know this is, let's say, the legitimate mask, or are they a counterfeiting mask? So the last small topic, the sub-topic, I will talk about the prevention. So how do we check this mask? Then we will move to another topic, focus on the opioid crisis. Opioid may not be the, let's say, you may not know here in your daily life, but in fact, in United States, opioid become a major issue. That's what we call the epidemic. We don't call that pandemic because that's a very important issue in the United States. So we will see like this opioid, how do we have this kind of issue? And then as let's say adult, or we may have the children, then how do we do all this prevention? And then to protect our family. So here, this is my short introduction. I think Catherine already have given an overview. I got my PhD and the master degree from Georgia Tech, ISYE, Industrial and System Engineering, Industrial and the System Engineering Department. Before I come to United States, I work at ITRI in Hsinchu, and then come to United States after I get a degree. I just go to the academia and then be the assistant professor for like 6 years, and then during that my assistant professor period, I was visiting professor in Singapore Nanyang Technology University, and also in the TUM Technical University of Munich in Germany. So now currently I'm associate professor at the George Mason. So this is just like overview about my education and work experience. In the next slide, I will just give you the overview about the research I have done in the past 10 years. One major research I have done is on the cybersecurity and the defense application. So let's say some example of application like infrastructure protection. We work with some major company to design all these drones, let's say the UAV, that kind of thing. How do we protect an infrastructure? So that's you may have like a nuclear power plant, and then how do we use all these kind of a drone to protect that kind of system? We also work with another university and the US government on the border security system. It's very similar. We need to design all these tower and the drone to make sure that our south border is very safe. And I also work with US intelligence community about the insider threat detection. So this kind of a thing help me to, let's say, help the government. Another area I focus on the commercial supply chain. I also work on the seaport and then Joint Street Fighter supply chain. So all these Joint Street Fighter, how do they, let's say, produce that kind of thing? Another one is a clinical trial. Also, I work with one major pharmaceutical company to help them to deliver all these kind of clinical trial. So especially in the pandemic area, for me, it's like I know how they ship all these clinical trial. I know how they, recruit all these kind of patients so that they can get enough information. So this is more like a second area I have done. But I mean, after I do this, I just recognize that yes, let's say we know all these kind of artificial intelligence, optimization, simulation technique, and if we do all that, we help company earn a lot of money, right? So that's we made it very efficient. Then I just recognize that yes, even though I work very hard and the company earn a lot of money, it doesn't mean that we can change the society, right? So let's say the low income people, they are still struggling. They don't have the people to, let's say, help them. So 5 years ago, I shifted my research area a little bit, try to understand all this illicit supply chain. When I say this illicit supply chain, like a human trafficking, so human trafficking is one of the major issue in the United States. We see so many human trafficking cases, either in United States. We also see some cases in the South Korea. You may hear like the end room, right? Human trafficking case, or let's say the Taiwan also have some like a labor trafficking case. I also, let's say, studied the kind of a counterfeiting goods and the OPOA. So we will talk that, these two today. But in this kind of work is like at least 5 years. Right now, our research work I have actually created some impact. It's not me, but our project PI, Dr. Ruiz Sherry. 2 weeks ago, she just present all our research work to the congressional staff. Including the House and the Senator, both party, the Republican and the Democrat. And then we use all this research, that's the outcome, try to help the government define the new policy so that we can see these kind of a policy actually, we can show all these kind of research result and then try to change the society. So that's like an overview about the research area. So now we will move to our main topic today, type of crimes in the COVID-19 pandemic. So right now, I think we don't need to give you the background about the COVID-19 pandemic, right? So we are in the pandemic. So right now, let's say during this period, like I have been locked down for around a year, stay at home all the time, and right now, let's say this criminal, in fact, they know, right? They know we are at home. So usually, when we are stay at home, what do? We use internet all the time, right? So right now, I can say that if someone cut my internet, I will want to cry because I cannot do anything. I have nothing to do, right? So right now, this criminal, they know this. So we can see like all these kind of crime, like the fraud or other like internet crime. The case increased a lot. One of them is like online and telephone crime. So like I think last month, I received all these kind of, let's say, the phone call, they just tell me, hey, you have one DHL package, or, oh, this is a China embassy, and then you have some document, please do blah, 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 that kind of thing. So I received around 3 phone calls per day, per day. They are very, very active. And then they know right now we are either online or or this stay at home. So that they know this way they can reach many people and then can earn a lot of money from this. Another kind of a crime we observe is a romance scam. Romance scam become very active during the pandemic. Most people, let's say, we lose our, let's say, social life, right? So we cannot actually go outside, talk to the people. And then all these criminal group, they also know, yes, right now, this kind of a Facebook, or you see, go to any like a dating website, they create many fake account. Usually they follow certain pattern. They will just say, yeah, I create one virtual person. That virtual person is have a wonderful job and earn a lot of money, but I don't know why. This kind of person, they just don't have their partner, and then they try to find a partner online, that kind of thing. So we see this kind of a case a lot these days during the pandemic. So you can see all these kind of a criminal group, they know. And usually this kind of group, from the cybersecurity view, is very mature. they have a clear script. So when they call you, let's say, oh, this is a China embassy, etc. Then if you say something, then they will, based on their script, say, oh, if you say A, then you need to return B. If you say C, then I need to say D, etc. So this kind of a procedure is a very mature. So in general, in the, let's say, criminal group, this is more like a low-end group because they already use the same technique for a while. They didn't change a lot. So that's another one is a phishing. You may see so many like a phishing email. I also see this kind of thing. They say, oh, sorry, your bank account has been, you need to change the password. Yeah, that kind of thing. And then right now during the pandemic, we see so many cases here. They know like when they do this kind of a phishing, they can get your information. They can try to behave like you to, let's say, access your account or your social security information. So that's another type of crime we have observed. Hacking is another one. So let's say we see several company, they have a like a hacking case. So this is for the more like the internet, the cybersecurity one. So we see so many cases here, but our life is so challenged, right? Internet, oh, there are so many like the criminal activity there. If we go outside, we still see so many criminal case there. They try to get whatever they can do. So if we go outside, the first one is the counterfeiting goods. Then all these, let's say, I would say not all, but many medical supplies or PPE, they are counterfeit. And we talked to, I think a few months ago, we talked to one Asian country, okay? And I talked to their, let's say, law enforcement investigator. And then when they do this kind of investigation, they say the whole country, maybe I would say around 1/3 of the mask, either surgical mask or respirator, are counterfeit. Okay, you can say 1/3. So if you buy any mask, one Asian country, not in the United States, and then 1/3 of the mask are counterfeit. Okay, so that is one major issue during the pandemic. Another kind of a situation is opioid, like a fentanyl. Fentanyl become a critical, I would say, the very one major death reason, like the overdose death reason for during the pandemic. Another one is they say deliberate dissemination. So you can say like a fake news or misinformation, that kind of thing. So that during the pandemic, we see so many cases. They try to let's say give you the wrong information so that that can go through the internet or go to other place. So they try to change something that could give you this kind of fake information to change your, let's say, political situation or something. So this is the major type of the criminal activity we have observed during the pandemic. So all that, we cannot cover all of them today, right? So it's too many. So today I would just focus on two of them. One is the counterfeit mask and the opioid. So this will be the one. I think others, let's say fraud, I think you may receive the phone call, right? Maybe in a daily basis. Phishing, hacking, you may see this kind of case. But counterfeit or opioid usually is hiding in our daily life. It's there, but you may not know. So I will focus on these two topics today and then give you more information about the counterfeiting goods and the opioid. So now we will move to our first topic, counterfeiting mask. So before we talk about the counterfeiting mask, we want to like a quick review about this mask. Let's say legitimate mask, the legal mask. How do they produce it? How do we distribute to your house, right? So this kind of, let's say, mask, we will talk about the, let's say, the legitimate, this kind of good. Then we will move the criminal case. So surgical mask, until now, I think most people recognize, in the United States, recognize that surgical mask and respirator can be a very good personal protection equipment for this, when you want to protect yourself, and then make sure that you can away from all these kind of, let's say, the virus. COVID-19 is one of them, right? So when we see all these surgical mask and the respirator, in general, this kind of, we will use the surgical mask as an example because this is easy, right? Because it's, compared to N95 respirator, is much easier. Then right now, if you cut all these kind of surgical mask, they will have usually at least three layer. We have an inner layer, outer layer, and a filter layer. And then usually outer layer, the purpose of that layer is clear. We want to protect against all these kind of water splash, so that when you have a water droplet, they will not, penetrate your mask. And then the inner layer, you want to make sure that they can observe the moisture, so that when you say something, then you will not feel like, oh, that's you will not feel like a moisture, inside your mouth. And the filter layer is the key, because usually they will filter out all these kind of, let's say, the droplet or aerosol, this kind of a virus droplet. So the filter layer is always the key when we see all these kind of surgical mask. So right now, if we just break down this kind of a surgical mask, we can see this is their major parts and what their raw material. Usually the inner layer and outer layer, they use, you can use cotton, right? Cotton is one of them, or non-woven fabric. Filter layer is a little bit different. Usually we use polypropylene. You can use others, but polypropylene is a major material for these, let's say, the filter layer. And then that filter layer, we use polypropylene as a raw material. Then we will create, we call the electric non-woven fabric. And then the others, you may see like the one metal strip that will help you to fix your nose, near the nose part. So usually you can either use aluminum or steel, and then ear loop, etc. So that's it's easy, right? So when we see the surgical mask, we can decompose them using all these kind of material. For this kind of material, the key thing is the key material is a polypropylene and the electric non-woven fabric. So these are the key component when we want to have this kind of, let's say, a surgical mask. And then this, let's say, polypropylene and electric non-woven fabric. The interesting thing is polypropylene is nothing new. If you see, let's say, diaper or let's say wipe, right? So these kind of things, they all made by polypropylene. So polypropylene is in our daily life, but electric non-woven fabric is new, because we want this polypropylene bring some static electricity, so that when you have some water drop, let's say the droplet, then they will be attached to your filter. So usually, if you see this kind of polypropylene, nothing new. But if you can produce electric non-woven fabric, then that will be harder, because most companies, they need to invest a lot of money buying that kind of equipment so they can produce electric and non-woven fabric. So that will be the key component when we have this surgical mask. So that's also bring another, for us, it's like a joke, right? So we know in the beginning of a pandemic, we see so many people want to buy toilet paper, right? At that moment, we know all these kind of structure. Then we're so confusing. We say, why people buy toilet paper? Toilet paper made by wood strip. Where is the wood strip here? Nothing, right? And then even you say like a polypropylene, but polypropylene made by the oil, right? By this kind of oil. So it's not come from the wood. So they don't match at all, right? So they use a totally different material. So that is the reason in the beginning we just say, maybe this is a totally different issue. It's nothing related to this surgical mask. It's like we buy the toilet paper to make sure we are safe, right? Safe for our, so that when we go to the restaurant, we don't need to worry about that, right? So that's a little bit different. Okay, so now if we see the production process, this kind of surgical mask, usually we need to, they go through one process we call the mill blow process. So what we do is all these kind of, let's say the oil, we put it, the petroleum, then we put that, and then they go through like the mill blow dye, and then we use the hot air and make sure they will just they blow it, and then we will collect it like a web, and then we will use the bonding process so that we can see a roll of the polypropylene, this electric non-woven fabric. The other layer, let's say the inner layer and outer layer, then that will be easier. So we follow the same process, cold air, and then we can create the same thing. Then we will say multiple two because it's the inner layer and outer layer. So usually the upper part, this electric non-woven fabric will be more difficult to do because it's take a lot of, let's say, it's a highly investment, costs a lot more money to install all these kind of production line. And then when we have these three layer, then we usually we will go to the assembly factory. What they do is they will use some we call the ultrasonic welding machine. So they will welding these three layer, and then we will see the later like the surgical mask. So that's their major procedure. So in the beginning, we don't see. I mean, most countries they cannot produce so many masks because two question: why is this area the mill down process? So because they need to make sure that they can have this kind of equipment, they can produce the qualified electric non-woven fabric. Another limitation is the ultrasonic welding machine. So that's another one. So this kind of a machine, only few country can have, few companies have the capability to produce this kind of a machine. So these are the two key issues there. Okay, so now let's say before pandemic, we already know these kind of, let's say, mask, who will be the major producer. Okay, so this is just give you the overall idea. This come from the trade map. So China produce most of the surgical mask, China. And then United States, Germany is the second and third. But I mean, in fact, this pie chart doesn't show you in detail. In fact, China dominated most surgical mask. I mean, before pandemic. So we already know China produced most of surgical mask. United States and Germany, they focus more on the high-end product. Let's say respirator. This kind of a high-end product, I mean, United States and Germany, they produce, they focus on this kind of high-end product. It's very similar to the other product. So that the low-end one moved to China, produce all these kind of surgical masks, that kind of thing, and then import to the other country, or export to the other country. So now this is before pandemic, but then the question will be, yeah, if we talk about this mask, China is a major one. So when the pandemic happens, let's say China have the capability to produce all these kind of a surgical masks, then let's bring another issue. So when we see all these, later on, you will see like a counterfeiting mask. So most people will say, why they all come from China? The reason is very simple, because before pandemic, they are the factory for all these kind of masks. So they know how to make a mask. Then during the pandemic, then these people, big country, there will be always the people who want to get rich, right? So that we will see all these kind of counterfeiting goods. And then many of them may come from China because of this. This is more like their background. So now let's see. Right now, if you see the news, you may see so many counterfeiting masks, news, in our daily life. This is just one. They say almost 70% of the Chinese KN95 mask doesn't meet the minimal safety standard. 40 hospitals across Washington state may have received a counterfeiting 95 mask. And this kind of let's say this news, I think is a very big news. The DHL and collaborate with the 3M, and they identify, I think, 10 million counterfeiting N95 masks. I think we will talk that later. So these kind of masks, in fact, go to 11 states of the United States. I know these 11 states, most of them is in the West Coast. Okay, Washington State, Oregon, and that kind of state. So that's it's a good thing. I mean, how should I say it's a good thing? But I mean, this mask. Before I check it, I don't see that they go to Georgia. So I think that's we are lucky, right? So that's we don't have this kind of a case here. And then Chicago border officer, they also say like they also let's say seize many N95 masks. And then they found like 10% of the test respirator filter than 95%. And then when we work with all these kind of agency, we found that some mask, this counterfeiting mask, if you have this kind of counterfeiting mask, it's their filter level, you may buy very high quality one. Some counterfeiting mask, in fact, they are high quality. You buy it, and then they may actually give you 95%, filter rate, which means good, right? They just don't have the brand. But the case is rare, okay? Most case, some mask, they can be just their filter, the minimal protection level. Maybe the lowest one I have seen is just 30%. When I say 30%, that means it is much lower than surgical mask. So you pay a lot of money buying a N95 mask, but the protection bring it to you is just almost the same as you put the t-shirt cover your mouth. Okay, so in this case, the counterfeiting mask is like they bring a lot of risk. We buy it, we pay a lot of money, but we don't know what kind of quality we actually get. So that brings a lot of issue to the society. So now we will see like how many, we want to ask ourselves, how many counterfeiting masks on the market? The answer is, if you want to know this kind of thing, the answer is very simple. We don't know. We don't know how many masks in the United States. Until now, we talked to many agencies, no one knows. We only know how many masks we seize. That one we know. And then if we just use the numbers, let's say in United States, let's say in the state, how many? Let's take a look. One, last year, U.S. Customs Border Protection, they have seized the following thing. We can see the numbers. One is the COVID-19 test kits. Test kits, how many test kits we have seized? Here is a number. So you can see it's not a small number. And then counterfeiting mask, how many? 12 millions. But these 12 million just means they cannot enter United States. That's it. But in fact, we will see more than this number. 12 million is much more than that. Our customs can only protect us, can only find 12 millions. And then from that number, we see roughly 51% originally in China. So we can see, like what I said in the previous slide, I mean, China makes sense because some countries, some factory, they try to earn more money. So that's they create all these kind of counterfeiting goods and then try to export to the many places. And then if we just check with the 3M, this data is just come from the 3M. 3M has identified 30 million counterfeiting respirator. So if we just talk about N95, they mark as 3M. 3M is just one of them. Although I know it's a major one, but there are so many other companies who also produce N95 respirator. So just for 3M, we already know we already identified 30 million counterfeiting respirator. So it's everywhere, right? So it's everywhere. And then usually they will try these counterfeiting goods. They sell everywhere. Some of them, they go to hospital. Some of them, they sell it on, let's say, eBay, LinkedIn, Facebook, all these kind of, let's say, social, I would say the social network. We also see a lot of, let's say, ads in the marketplace. Okay, marketplace can be Amazon, can be other, all these kind of e-marketplace. So it's a lot. They also have a certain website, the kind of thing, to try to sell all these kind of masks. And then when we review all these kind of counterfeiting mask, case, some of them still under investigation. These criminals, they are smart. They really know how to run this kind of a business. Some of them, it's very impressive. They are too smart. I can tell you, they are smarter than me. I'm so sure, because they know how do they create all these counterfeit goods without people, without being caught. Right, without being cut. So they really know how to run this kind of business. So right now we know there are so many counterfeit goods, right? So the mask, respirator on the market, right? So the question will be, how do they enter this? Why we get this kind of counterfeiting goods? We should have when we go to any retailer store, we should buy, the legitimate one, not the counterfeiting goods, right? So to start this topic, we need to think about the entrepreneur, okay? So we need to talk about these words. Why? Because if right now, we talk to these young kids and say, hey, in your mind, who are the entrepreneur, okay? And how do you define entrepreneur? Most people will say, yes, Steve Jobs, because Apple, blah, 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 blah. And then Elon Musk, because, he really know how to do all these kind of things. He know how to do the marketing stuff, right? That kind of thing. Or Bill Gates, he really can change the world, blah, blah, blah. That's how we say the entrepreneur, right? So if we see the definition about the entrepreneur, the definition is clear. They have they really know how to use their limited resource. They know how do they promote their work, right? Promote their work. They will identify a new business model, right? Their new business model. This is how we call an entrepreneur. If we see this kind of definition, I can tell you, in my field, we always call these criminals, most criminals, they are entrepreneurs. They are really smart. They will check the current situation. Yes, I know most people are, in the lockdown mode. They need to stay at home. They cannot go outside. This criminal, they will say, this is new business for me. Okay, then from them, they are smart. And if we see right now, people get used to this kind of a China embassy. You have an important document, blah 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 blah. Then they will identify the specific person. They will just say in the beginning of them, they will just call everyone. Now, no, they will say, their last name seems like a Chinese, so let's call them. So that they do this kind of a thing over time. So they try to adapt to the new environment every month, okay, every month. So that's also bring us a lot of trouble, right? So the way we identify this kind of criminal, we need to change over time. So right now, what we did is in the previous one, this investigator, they need to create a case, understand all these people. Right now, we need to develop a lot of artificial intelligence, so that whatever you did on the website, then this kind of engine, they would directly know, right now, this is some weird activity. We need to do the investigation. So right now, it's changing, because we also need to learn quickly to against these criminal activities. So now, to go back to our mask, this is a very high level supply chain structure. Let's say here, this is a mask distribution network. So usually you may see many, let's say, factory, like a mask factory. This is more like an assembly line, so that they will have a supersonic welding machine, and then they will produce all these kind of, let's say, surgical masks. Usually this kind of factory, they also have their, let's say, outsourcing factory, can be in different location. And then we can see like a wholesaler, this kind of distributor. So you can see Costco is one of them, but sometimes you will see a lot of a wholesaler one. And then this kind of a wholesaler, they may sign a long-term contract with a hospital and clinic. So for the hospital and clinic, they always can buy like a very cheap PPE because they already signed this kind of long-term contract. Retailer is another one, then they will reach to the end user. So let's say if you go to the supermarket, or let's say the Walmart, the kind of a store, then this is a retailer, then they will distribute to the end user. So this is a very high level. We don't capture like a forwarder or let's say the broker or like the overseas transshipment, but this is just like a high level one. So right now I will use this diagram and then try to show you these criminal cases. We summarize as 6 major type. How do they enter this, let's say, legitimate supply chain so that we buy this kind of goods? Okay, we got this counterfeiting mask. The first case is they will do the defective mask. Let's say in the beginning of a pandemic, we see so many cases that the game group, I can tell you like for example like a game group. In the beginning, this game group they will just get the money from like oh, I will protect a certain store, so give me the money, that kind of thing. But during the pandemic, a lot of stores are being locked down, right, so that they don't open. So some like a game group, they want to produce this kind of a mask. So even game group produce, counterfeiting mask because they recognize that the mask is equal to the gold, at that time, right? Mask is equal to the gold, and it can be even, more important than the gold, because the gold doesn't mean you can buy the mask, right? So that we actually see all these kind of a game group, the kind of thing, they create their own factory. And then they produce this kind of, let's say, surgical mask. And then the interesting thing is this kind of factory, they produce 24 hours, 7 days, non-stop, because they will always have the people, they could create, they produce this kind of a surgical mask. But the question is, we go back to the previous slide. We say, yeah, surgical mask, filter is important, right? Filter layer is very important. That the polypropylene layer, and then this kind of, they say, we need to make sure they have a electric non-woven, filter fabric, that kind of thing. They cannot get that. So this, at that stage, the mask they create is very simple. 2 layer, inner layer, outer layer, done. Or some of them, they will just put the cotton in the middle. So look like a 3 layer. But in fact, the middle layer is just cotton. So it's useless, right? So it's, for me, let's say when I see this kind of a thing, it's similar to just put the t-shirt, cover your mouth. It's the same thing, right? So you don't have any filter there. So this is a one type. They will want to create this kind of a defective mask because mask is the gold. Mask is money. Okay, mask is money. So this kind of a factory, we see it in the let's say the early stage of the pandemic. Usually it's like 1 year ago. So we see this kind of a case a lot. Another one is you may not buy the mask there because most wholesaler, they will try to hold this kind of they will try to hold this mask and then don't give to the downstream. We see so many cases that the hospital, at that moment, they cannot get the mask. But if you say why, the reason is very simple. This hospital, when they talk to their, let's say, supplier, long-term contractor, say, I need a mask. And we have a long-term contract. You need to give me all these masks. Wholesaler, the illicit one, okay, not everyone. Illicit one, they will just say, wait a moment. Right now, if I give you this mask, the price is so low, like this surgical mask, I need to follow the original contract. So that's the mask is so low. So if I hold it in my warehouse, I don't give it to you. I can give it to other retailer. Other retailer may pay 10 times more, right? 10 times more. And then for this hospital, I can always say, right now is because of a pandemic, the supplier didn't give me enough masks, so I cannot give it to you. But in the meantime, they only need to give to the retailer, and then they can do something like a price gouging so that they can pay. This is in fact, this is one real number, okay? So they can charge 10 times more to this retailer. then retailer can also, they also want to earn some money, right? So that when they distribute to the end user, they also can increase the price to the end user. So I mean, we see so many cases like this. For example, like a 3M, they have one case like a lot of let's say this kind of a distributor, they try to ship this kind of, this is I mean legal one, but they ship the Peru. I mean 3M have one factory in Peru. Peru produces some N95 respirator, but then they try to they distribute it to United States. The reason is very simple, because let's say high price, then they want to distribute it. However, 3M have a legal, I mean, have some rule like for the Peru factory, you only can distribute to in Latin America. You cannot send it to the North America. So this kind of a case, we see many of them during the pandemic. This is the case 2. Case 3, the import defective mask. This is another case we see during the pandemic. What they do is very simple. They may import from other factory, and then, you know, mask, they have some of them is for medical use, like I mean, different kind of filter. Some of them can be non-medical use, right? So for the job, they kind of thing. So we see many cases, they will import this non-medical mask. And then when they come to their factory, they just doing something like changing the label, you know, you just delete that non-medical, non-words, right? So non-medical change to medical mask. Then they can sell high price to all these kind of things. So we also see so many cases like this. So that's another case. Another one is this kind of factory. We also see like we see so many underground factory. Like what I say, some country tell us like some Asian country tell us like, oh, 1/3 of a mask they all produced by the underground factory. Usually, a factory, if you want to produce a medical equipment, the certificate take around a year, so that they need 1 year. But for this, for example, like a game group, they cannot get the certificate for sure, right? So that they will just go to a very, you know, a very, I would say, very poor house, you know, that kind of thing, and then produce it manually, right? So that is another one we see during the pandemic. Another one is a change in product label. There are so many, let's say we see so many countries that, I mean, manufacturing, they create we call share company. For example, like usually they want to create another country in some, I mean, maybe like Hong Kong, this kind of a country. So they create I would say a virtual company. Then what they do is they will ship the goods to this kind of a country, and then change the label, change it from like a made in country A, and then they change it to made in country B, the kind of thing. Or they may change the label there so that they don't know what's going on there. Then they can distribute it here. So we see one case, like a 3M case. We see one case that the company, I mean, the counterfeiting, you know, that company, the company produced counterfeiting respirator. They produce N95, mark like a 3M, but in the beginning it's made in China. And then when they ship to the other country, they just change it, say, oh, right now it's made in Peru or made in other country, and then they can distribute to the hospital and the retailer. So that's another type we have seen. Another one is international mask of fraud. That kind of thing until now still have. We see the similar type of criminal activity for the COVID-19 vaccine test kit. They have a similar pattern. What they do is they copy exactly website. For example, some country, they will copy 3M, but they will say 3M.ru, 3M.tw, for example. This is just for example. Or we also can find like Moderna.ru, okay, so that kind of thing. So what they do is they copy the website exactly, but they just change a small name. So they look like the legitimate website. And then they will say, hey, right now, yes, you believe my website, right? So if you want to get like a 3M a mask or other, you know, kind of mask, you just go to the website and then order it and pay it. But this is, you know, this is not the real one, right? So that when you pay the money, you will never receive your mask, or you will never receive your vaccine, that kind of thing. So this is another type of, fraud we have seen during the pandemic. Okay, so now we will talk about one case about the 3M one. 3M one here, I just show you the picture from the, you can see the report from DHS, so that you can see these are all the counterfeiting masks. So you can see how many counterfeit masks here. And then, in fact, if you open it, they look just like a 3M counterfeiting mask. They also have like, it's an NIOSH and the certificate, everything. And even for the hospital, there's a medical professional, when they recognize this, they was shocked. They just say, wait a moment, this kind of mask smell like a 3M, use like a 3M, but you tell me they are counterfeit? They don't trust, they don't believe it. But in fact, these are the counterfeiting goods. And then here, when I open it, you can see these are all the 3M. They also have like their label. So you can see here, they can look like, oh, this is a 3M. And then it's a Peru and the USA logo here. So these, but in fact, all of them are fake. It's not real at all. And then we also see other case, like and right now still under investigation, that some people actually take the video in one factory in China, and then in that warehouse, I can tell you like that warehouse is around 4,000 square feet, and then I cannot count how many counterfeit masks there. It's a lot. It's like a full warehouse. They all counterfeiting masks. So this kind of thing it's there. We know it's there. It's everywhere. Okay, so in our research, in fact, we collaborate with many companies, and then we identify several factories that they producing the counterfeiting mask. And then we also, we have a capability, we collaborate with some companies so that we can check their route. So how do they ship, where do they go? And then do they have one like a virtual, sure company in other country, that kind of thing. So that we know like all these surgical, the counterfeiting mask, most of them come from China. So, some people want to get rich, right? And then the good thing is that China government, in fact, they also do some investigation. So when we identify the factory, that kind of thing, and then we give to the China government, they will actually seize this kind of a factory. So they will make sure that everything, this kind of a factory, they will be gone. But the issue is, if we don't find the evidence, then China government may not know where they are. So we need to identify where they are, what are they doing, how do they ship, so that we can make sure that we can get rid of this counterfeiting mask. And usually their path, they will ship to the United States, let's say by sea cargo, or some of them, they will try to go to the Latin America. And then when you go to the Latin America, and then you change the label, just like not made in China, but made in, they say Peru, for example, then it will be easier to enter United States. So that's another path they will take. So that's the path we have found. And for end user like us, how do you know right now you have a counterfeiting mask, or let's say you want to test the counterfeiting mask? There are several ways you can do. One is, this is the surgical mask. I purchased it from Taiwan. So you can do several things. One is you can just, put some water, on top of your outer layer. So then you can see, hey, right now, will they penetrate your mask? And then for, is that safe? That kind of thing. So that's one way you can test the outer layer. For the filter layer, which is critical, right? The filter layer, then you can just cut it and then check, they have a 3-layer. And then if they have a 3-layer, the next step, you can check their, let's say, static electricity. There are several ways you can do. One is you just use your hair, or you can cut a very small piece of the paper. Then you can say, yeah, will they attach to my filter layer? So that's another way you can check. And then another way you can do is you just burn it. And then this is one video I made, and you can see that when we actually try to like fire this kind of layer itself will be very similar to the to when you like burn a candle. So if you, let's say I need to stop somewhere here. So in fact, it's like you burn a candle. So in fact, you will not see ash here. So instead, you will see wax here. So then, because you know this kind of the filter layer is made by polypropylene, so it's made from the oil, right? So in this case, when we burn it, it would not like a paper. They should be, you know, very similar to the candle when you burn it. But I mean, this kind of a test, you can do it at home. If you see some mask, this doesn't, I mean, fire like this way, they may use other material. So this one just tests for the polypropylene material. They may use other material, but the key thing still be the electric non-woven material. If they have bring some like a static electricity, you should be safe. You should be safe. Okay, and then if you buy like the 3M respirator, how do you check? The first one, you want to check their lot code. These are their lot code. If your lot code is one of, one of them, you know, in this list, you have a high chance to get the you know, counterfeiting mask. Another rule is if you see like these models, 1860, that's a majority one in the United States. And then if it shows like it's import from other country and import into the United States, then they have high chance to be the counterfeiting mask. Another one is 3M has a hotline, and then they have a lot of information there, so help you to identify their like a 3M product. And then here, this is if you see this kind of a logo, like a 3M Pollute USA or 3M NN Minnesota USA, that kind of thing, these are all counterfeiting masks. We know that. So that is the general rule. If you didn't buy 3M, then you may need to contact their company. I know other company, they say like Taiwan have another one major N95 mask manufacturer. Then you may need to contact them to check from their data set. So that's another one we can check. I think we are almost run out of order, so I mean, run out of the time. So for the opioid crisis, I think I will quick over this slide. I cannot over all of them, so I will just give you some idea here. So right now for the opioid, I think that I will just quick over some slide. Opioid, you may say opioid is none of my business, right? So most people will see this way, but in fact, it's not true. Opioid crisis right now, it become the major issue in the United States. This is the CDC's data. We see if you want to know like what's the major cause of the death, right? So I can tell you, opioid in our age, right? So for the teenage or for all these kind of, let's say every age lower than 45. Opioid is have the more like a fatal rate compared to the COVID, compared to the cancer, compared to the heart disease, that kind of thing. So that's many people died because of the opioid. So this is 2018. And then this slide, I think that I cannot go over all of them. So I think I will quickly over that. Right now, these days, opioid is a major reason. And opioid, right now you can see all these charts. In fact, opioid, they jump a lot, especially during the pandemic. Most people died because of the fentanyl, because of this synthetic drug. So many people died because of it. So here, I think you will see many news. Many news. I cannot count. It's too many. But the worry thing is, usually if you see other drug, they say heroin or cocaine, this kind of thing, usually it's like the low-income family. Fentanyl is totally different. Median income, high-income family also have the same issue. Their kids, some of them, they are overdose. That kind of thing. They have an overdose issue. And then fentanyl is also another major issue in the United States. So that's the reason we call fentanyl as epidemic, because too many people die because of this. So during the pandemic, and then opioid become an even major issue, and then we can expect that even though this pandemic is over, opioid issue will be even larger because right now more people, they may lose their job, then they buy this kind of fentanyl stuff online, the kind of thing, so that we cannot prevent that. So if we see this is fentanyl, in fact, they right now we have a consensus in the society. Most of them come from one country in Asia. And then 3 years ago, we see so many cases that United States people, let's say American, they don't know Mandarin Chinese, but they learn how to use Alibaba, Baidu, that kind of thing. They suddenly understand certain keyword in Mandarin Chinese. They go to Alibaba, they kind of a website, purchase fentanyl, and then ship to the United States. And then some case, I can tell you many cases. One example is just my university student. I mean, in their dorm, they just purchased it, and then all these investigators just recognize that before he have the fentanyl, and then this fentanyl, they just check their computer. They all purchased it from this kind of Chinese website, but he cannot speak Mandarin Chinese, but he know how to buy these kind of goods. These years, this kind of case, I mean, the U.S. government do a lot of things and then collaborate with the China government. China government collaborate a lot, so that this kind of case, I mean, we don't, but we still can find some cases on this kind of a Chinese website. So for us, if we know this kind of Mandarin Chinese, it's easy to get. Some cases in the United States, in fact, they say for these teenage, buying fentanyl is much easier than buying alcohol. You know, some parents just say that. So it's too easy to get it, and then it's difficult to prevent this kind of situation. But right now, the majority one is most company this entrepreneur. They know, like United States right now, we check every package from China. So what they do is they don't produce the fentanyl anymore. You know, China government also prohibit the fentanyl. So what they do is they produce we call the fentanyl precursor. Precursor itself is like I always give one example. Like if fentanyl is your dinner, you can order Uber Eats, right, or DoorDash to your home. So it's like this path. And then United States just tell you, no way, don't send this kind of thing to me. It's a fentanyl. So many people already, you know, I mean, overdose because of that. Then what they do is they produce, we call like a home kits, right? That's we call the fentanyl precursor. So it's not fentanyl, but it's a raw material. You just need 3 steps. It's like, you know, the home kit that you buy. If you just go to the microwave, okay, please, 3 seconds, then you have your dinner, right? So that kind of a fentanyl precursor is like that. So then they don't ship to they still ship to the United States, but a small amount. Most of them, they ship to the Mexico, and then they work with this kind of Mexico cartel. Then they will produce the new kind of fentanyl drug pill, and then they go to the original, let's say, heroin distribution network, enter United States. This kind of a path right now become the majority to, I mean, this kind of drug come to United States. And then this, let's say, Mexico cartel, what they do is will be a little bit different. In the beginning, China sent, I should say the Asian country. One Asian country is sent to the fentanyl directly to United States. So the purity of this fentanyl is nearly 90%. So small dose, then we have over that. Mexico cartel, they operate this kind of drug for a while. So they know I cannot give you too strong drug. So what they do is they will change their purity from 90% to 10% only. But they will mix with heroin or cocaine mixed together so that the people, these kind of people, when they get it, then they cannot stop. They cannot stop. So that they can run the business forever. You don't want your customer to die. So the interesting thing is when we see the first pass, the company, you know, in this country, they also pay your, let's say, hospital costs. So if you buy their product, they have a wonderful customer service. So when when you see this kind of, let's say, when there is some people, they have overdose and then they go to hospital, the supplier, they will buy you a lift trip. Make sure that you can go to the hospital, that kind of thing, because they give you the quality, guarantee, the kind of the customer service. Here, when you go to this path, they don't, because the dose will be much lower because they want to make sure you keep it forever. But then you may say, hey, right now, it's I mean, we don't buy drug, right? So we are safe, right? In fact, it's not, because right now in United States, we see so many. You can buy a lot of medicine online without prescription. So, I mean, right now in the society, we already know like there are so many illicit online pharmaceutical. If you want to buy certain drug, you just go to, maybe you just go to, you Google it and say, oh, I need to buy, medicine A. I Google it, and then it will pop up a lot of information, right? Then we will, this kind of affiliate website, they know their relationship. They will post these kind of ads to your social media, can be Facebook, it can be other place, and then tell you, yes, you can buy from other company. This kind of company, they may not need the prescription because a lot of them is hosting outside of the United States. They may host in India, they may host in Canada, in the other place, so that you can buy it. They will ship to your house in United States, although they are illicit. So then they go through the certain payment website, they have like the payment network, etc. So this kind of situation is very, I would say, it's very common in United States. So when you buy this kind of a drug, some of them, they may say, oh, you need to buy OxyContin, that kind of thing. But in fact, they give you illicit fentanyl. If you buy medicine A, I give you another, fentanyl, because I know when you take the fentanyl, you will keep it forever. You will always come back to me and then buy more and more and more. So that's the reason a lot of people in the beginning, they have a sport injury. And then later on, they recognize that, oh, if I buy the medicine online, I can bypass all the medical system. Then later on, they don't know they are taking the fentanyl until they have an overdose death. So that's right now what happened in United States. So fentanyl right now, I mean, they are so difficult to control it because it's a synthetic drug. If I change their material a little bit, then become legitimate. So let's say like China and United States, we do like the scheduling control on certain days. So we have some like a collaboration. So this kind of a fentanyl, fine. But then these criminals, they are so smart. So then they will find a new formula, create a new element, that kind of thing, so they can bypass the detection, right? So they also like a camouflage as biotech company in industrial region, so that the people cannot easy to identify them. So that's what we do. So this is some map. We identify several factory. That's where they are and how do they produce these kind of, let's say, the fentanyl precursor. And then usually, let's say we also have you also can see the picture like this medical cocktail, Mexican cocktail. How do they like use this precursor and then cook? This kind of, they cook it, and then they will make sure that right now they produce this kind of a pill. For our research, what we did is we know this is a state of the art. So we collaborate with many U.S. government or the company. I mean, we collaborate with some company who do the cryptocurrency. So if you buy any Bitcoin, that kind of thing, in fact, we can trace like their transaction, that kind of thing. So that's one company. In fact, that company is the one who identifies South Korea human trafficking store that case. So it's detected by them. And then we also collaborate with many critical company and payment processor, so that when this kind of criminal, they do something, we know that. We collaborate with NYU for the dark web side. So dark web is usually misused for all these kind of, let's say, the drug transactions. So that's a computer science professor. His work is more on this side. And then we also do the information flow with many company, I mean, government, US federal agency, or let's say non-profit company. So right now, if you post something related to all these kind of drug information or counterfeit mask, we can identify that information, and then we have a certain process to find where they are and where are these people, how do they ship, that kind of stuff. So physical flow, we collaborate with a U.S. agency, so that some of them is in the defense enterprise, some of them is in the intelligence community, so that we want to protect all. Through these three flow to understand all these illicit supply chain, and how do we protect us in the state. So right now for the prevention, yes. So if you want to prevent this, first one, you want to check the pills that your family has taken. So if you see some medicine like this, like M30, then it should be the fentanyl. So that's it. You need to know that the kind of thing. So if someone taking some pain reliever, that kind of thing, you may want to check that. And then educate your, let's say, family. And then social media is another one. Although we cannot check the social media, we need to keep the privacy. But we know many cases they get these kind of drugs using all these social network. That's why if you buy any, let's say, drug online, you need to make sure that they have a certain certificate. So you may want to check their certificate. So that's the last slide. Yes, I finished all the slides.
Thank you. That is so great.